Fuck you, my child is completely fine.
Okay, so obviously I have no idea what this person's particular health issues are, and so definitely not commenting on them in particular. But this raises a great teaching point about one of the most commonly missed OCD diagnoses. Some people refer to it as just right OCD, where you basically have to do things until they feel right. Another word for it is incompleteness OCD. So you have to do things until they feel complete. So it's not the traditional OCD where you think something bad is going to happen, or you have really disturbing thoughts that you feel like you have to get out of your head, so you engage in compulsions to try and get rid of them. But it's just a feeling of like not quite rightness or incompleteness, and you have to try and balance it out or do something to make the feeling right. Kind of. So we all definitely have weird things that we do, right? We all have our own idiosyncrasies, and that's beautiful, and that shouldn't be taken away from anyone under the guise of it being a psychiatric illness or anything otherwise. The difference here between it just being something fun and quirky that you do and being obsessive compulsive disorder is how much it disrupts your life and how much it bothers you. So for example, if you like stepping on the cracks so it feels just right on your foot, then all power to you. If it's not interfering with anything, you go for it. You step on those cracks just the way you want to. However, if it's so problematic that you can't get on the bus to go to school because you're sitting there stepping on the cracks and just can't get it right, that's a great example of this just right OCD or symmetry OCD, where you just can't function. It's so upsetting and so anxiety provoking that you can't function. You can't live your life like you normally would. You guys ask such good questions. So if it's not interfering with your function and it's not something that's bothering you, then we wouldn't classify it as a disorder. That's just kind of a hard stop in psychiatry. No reason to pathologize something that isn't bothering you. But sometimes there are people who have some of these traits that are similar to OCD, but they don't quite fit the criteria, and maybe it doesn't really bother them that they have those traits, but it causes problems with their life. For example, they like that they're perfectionistic and very focused and very precise about things, but it makes them turn in their assignments late. Oftentimes, this is something called obsessive compulsive personality disorder, or OCPD. People with OCPD tend to be preoccupied with rules, organization, schedule. They are perfectionistic to a fault where they're unable to actually complete things because of the perfectionism. They have a really hard time delegating tasks because other people don't do it as well. A lot of you guys had this question. It's a great one. So let's just talk about OCD in general. So the O stands for obsessions, and that refers to any thought or urge or image that might come through your mind that is disturbing or unwanted or sort of something that you would normally not think about. We all have intrusive thoughts like these, but in people with OCD, they become very frequent and very disturbing. The C stands for compulsions, and compulsions are basically any act that you perform to try and get rid of the obsessions or try and neutralize them. So these can be behaviors that we can see, for example, washing your hands if you have a fear of being contaminated by germs, or they can be mental acts, so counting to a certain number every time you do something, or praying in a certain way to help you feel better about, your family being safe. You actually don't have to have both obsessions and compulsions in order to have OCD, but most people do have both. Okay, so we talked about obsessions and compulsions and what they look like, and let's talk a little bit about the types of obsessions and compulsions that we see, with the note that really anything can become an obsession or compulsion, and people tend to fit in more than one of these categories, so it's not precise. So first is cleaning OCD. People with cleaning OCD will have a fear of contamination or illness, and they may wash their hands excessively or have these elaborate, precise cleaning rituals. Next, we have symmetry OCD, or just right OCD, where you have to repeat things in a way that makes them feel just right or equal on both sides, something like that. People can have OCD with forbidden or taboo thoughts, so these are usually sexual or aggressive or religious thoughts that are disturbing to the person that they try to neutralize with things like prayer or counting. And then there's harm OCD, so fear that harm is going to befall you or a family member and having to go back and check the stove, the locks, etc.